Welcome, everybody. My name is Dzedzy. I'm the Public Health Director for Lincoln County Health Department, but I also serve as a Region 9 Healthcare Coalition Chair. And I can tell you that it's just exciting to see so many people in the room today. And we actually have 7 or 8 people out on GoToMeeting as well. So we've got a pretty good turnout today. And just kind of a couple reminders before we jump in. Giving everybody just a reminder of who we are, the Region 9 Healthcare Coalition. We are the purple lavender colors on the map there, if that's what you want to say. But we are more inclusive every day with our Idaho partners, which is a great relationship, and some of them are in the room here today. So although you see the color on the map, we don't necessarily guide ourselves by that color. We guide ourselves by our healthcare partners. And I think my next slide is just a reminder of our mission. The mission of the Region 9 Healthcare Coalition is to prepare for, respond to, and recover from crisis using all available resources to provide patient care at appropriate level in the most efficient manner. And in order to do that, it takes all of us in the room here to work together to make that, for us to achieve our mission. And before I go on a whole lot farther, I am excited today. We had to schedule another meeting just so that we could get Devin Johnson here. But we have Devin Johnson as the Chief Operating Officer for Deaconess Medical Center here with us today. He's got a few minutes. So we cornered him and asked him if he could update us on the transitions taking place at Deaconess with the transition over to multi-care. So Devin.
Appreciate it, thank you. I don't have a formal presentation, so I was asked to just kind of give a quick update, and if there's any question or answer, and this is kind of loud, so I apologize. Again, my name is Devin Johnson, the Chief Operating Officer at Deaconess. I've been here once before to talk to you guys, so I appreciate you having me back. I didn't get any tomatoes thrown at me, so that was good. I think most everybody's heard, and we're all obviously very excited for it at Deaconess and the Rockwood Health System, that multi-care, which is a community-based, not-for-profit, headquartered in the Tacoma area, in their interest and in their growth, has approached CHS to create a statewide health system. And you know, I wish Bill and Florence could be here to do this presentation or this conversation, but they have a great vision. They are a well-funded health system. What they're looking for is they want to be the premier healthcare provider in the Northwest, and they define the Northwest as Washington, Idaho, Montana, Oregon, and Alaska. So obviously a tremendous amount of growth that they are currently undergoing and will continue to undergo in the future. One thing that was very exciting for this community is the way in which multi-care, if you guys have interacted with them in the past, value the interactions with the community. I think that's one thing, and I've heard it over and over again, so I know it's true, that really was lost in the Rockwood Health System, given the challenge of the last 5 or 6 years or more. There's really been sort of a disconnect between what's been going on within the health system and what do the community needs. And that's one of the things that multi-care values very highly. Actually have, I'll try to stop saying the word here. You can hear yourself when you say it. They actually have a community grant program in Tacoma, which is interesting to look at here, where they have funds available through their not-for-profit status and donation to actually fund programs like this and other programs that would be important to the mission in which they're trying to deliver. They also are very innovative. A couple of things that they do out there vision-wise that we've been really impressed with. There is a huge statewide need for psychiatric services, and they're not a psychiatric provider or have not been a psychiatric provider. So their major competitor is CHI Franciscan. They have about the same size health system in the immediate Tacoma area, and they looked at each other. They're basically office buildings and kind of see each other. And they got together and they said, okay, what's the need for psychiatric? And the two of them partnered together to build an actual psychiatric hospital, and that's being done now. And then they expanded into pediatric psych at their pediatric hospital in Tacoma as well, too. So very interested in sort of meeting the community needs, and they're able to partner with other competing health systems in the areas that you need to partner in. The transition is going very well. I've never been through an easier message to manage, honestly. Most of the time when we have to manage messages, it's not a great thing. Literally, my pharmacy director, who's just a great guy, fist bumped at the announcement, just, was very, very excited. We had staff high-fiving each other on the floors. So you can imagine things are going very, very well. People are very excited. A lot of questions still to be answered. We don't know the close date. I wish I could tell you that. There's a lot of things that have to go on in this big of a transaction. One of them, of course, is a filing with the state's CON, filing with the federal government for antitrust. And all that process is going on now. Documents are being created. And you're sort of dependent on the state with that. So the tentative date was May 1st, April 1st. If I had to guess, this is my guess, I'd say June or July 1st would be the actual transition date, just given the time in which the states and those federal agencies respond to these types of evaluations. In the meantime, you really can't plan together, right? They can't get involved with our operations here. So the focus of the transition is what happens day one, and then what happens as we go forward. One of the things our team is really excited about is it's not necessarily coming in as St. Luke's, we used to call it St. Luke'izing people. It's not always multi-carrying on. The question is, how do we kind of create a system that takes the best of both worlds and apply it to the community to meet them? One of the things they've done down there, an example of that is they have called Indigo clinics. These are urgent care clinics, and this community has a ton of urgent care clinics. But their Indigo clinics make a commitment to seeing patients from the time they get into the clinic to the time they leave the clinic in 30 minutes, which I don't know if you guys have ever been to an urgent care, it's a couple-hour wait. And so in their Indigo model, you walk in, they have a concierge, person's got an iPad, they're taking you in, they're getting you back, you see the providers, they staff it appropriately, they got the FPAs, the MAs to do all the work. And their average time has been 28 in their Indigo. Point being, that's kind of the innovation. That's kind of where they want to see healthcare go, and that's what they want to be able to bring to this community. So one thing that the community, I think the providers are most excited about, not to mention being part of a statewide system that's, based in the state of Washington, but they're bringing Epic in, which is an outstanding statement for this community. So all of the Rockwood Health system would be on Epic. We know that Providence has already moved to Epic and has done a great job with that. There are opportunities to share data back and forth within the Epic platform itself, which makes it nice for patient perspective. So while it never works perfect, it's a step in the right direction for both the providers and the patients. So like I said, I don't have a whole lot to say. Because I don't have a formal presentation. I wish I could give you more information about multi-care. Like I said, they're a very well-funded system. They're paying for this. This does not put them in a difficult situation. But as we get closer and the state stuff comes in, we'll know an actual date, and love to come back and give you a little bit more detailed information. But any questions or any comments or any concerns from this group as it relates to this transaction? All right, thank you.
And I'll say it formally to the group. Thanks, Devin. That was interesting. It was exciting. And I think there's a lot of excitement around the community about some of the transitions that we're hearing. So thank you for taking a few extra minutes out of your day to spend with us today. So now back to me. What I think I'll do before I go on to my next slides is this is not on our agenda, but I think it's important to our work. And if I'm too loud, just let me know, and I'll try to tone it down a little bit. A couple of the other things that the Healthcare Coalition is working on that is not on the agenda, and some of you have probably seen. One of those is we are actually utilizing our situational awareness tool that was developed by the Healthcare Coalition last summer. This is a tool to quickly send out questions to the healthcare system, appropriate representatives of the healthcare system, get that information reported back, and to be able to develop a region-wide situational report so that all of our healthcare partners have an understanding of how the healthcare system is being impacted. This alert process right now is really focused around influenza. As you've probably heard on the news with and even here today, I think in conversations about how the healthcare system is being heavily impacted with patient loads. Hospitals are full. Hospitals are having a hard time finding places to send their patients, especially on the west side, who has been hit really hard the last few weeks. So we've started to initiate this process, use this process, share this process, provide incredible information to all of our hospitals and other healthcare partners that have responded about what is the current status of our healthcare system and how is the influenza outbreak impacting us. So obviously this is still an area in motion. If you have ideas, suggestions, thoughts on how we can make it better or how we can improve it, we're always looking for ways to improve the work that we do. But I did want to share that to you. So far, it sounds like it's going well, and we've heard a lot of good information and feedback from our hospital partners. Just a couple of other things that we're working on or continuing to work on. We are also moving forward with our patient tracking modules and patient tracking system in our region. Mark Sheldon is our committee chair and has reported to on this work in the past. Just want to let you know we're still moving forward with that. We've got a ConOps developed, which is currently under review. And hopefully we'll be ready to exercise that and start to move that process out so that during a mass casualty incident, we have a system in place with our hospitals to track those patients and know where they've been transferred to so we don't lose anybody. Another process that we're working on that we've talked about and the work continues is having discussions around our Disaster Medical Coordination Center roles in our region, how to improve upon those roles, how to make our DMCC system work better. So just want to let you know that work is still continuing. We actually conducted an exercise last month utilizing the communication center here at Spokane Fire to place patients from an MCI event on Interstate 90. The exercise was a great learning opportunity for us, for the Combined Communication Center, and for our hospitals in Spokane on how we can make that process better so that when we have a mass casualty incident, we can take those patients from the scene as fast as we can and get them placed at the appropriate level of care. So it was a great exercise. That work continues. We are going to practice and exercise that role on a monthly basis, believe it or not, for a short time so that we make sure we get the kinks worked out and the improvements that we need. And then we will start to utilize that process as we probably and see how it implements across the region around mass casualty incidents. So that's just some quick tidbits so that you know we really are doing things that we've gotten feedback from you guys that we need in our region. So those things are moving forward. And now a little bit about today's agenda. We want to spend a little bit of time around the CMS rules. As we all know, the CMS rules were adopted in September 16th, 2016 with an implementation date of November 15th, 2017. The emergency preparedness goals of these guidelines are to address systematic gaps, establish consistency, and encourage coordination. And by golly, that's been our mission with the Region 9 Healthcare Coalition for a lot of years. So our goals and their goals are in alignment, and with all of us working together, I think we can get there. The CMS guidelines really are drafted towards 17 Medicare, Medicaid provider types. And so what we are looking at here as we move into the rest of our day today and our next 3 HCC meetings is we want to look at a process to establish work groups, to help you gain from the knowledge that you have, the expertise that you have within your provider types, so that you can all move forward, we can all move forward as a region by sharing resources, sharing ideas, and coming together. So for today, and I apologize if these seem a little bit discombobulated. I kind of threw these together quickly before we came, so I might be a little bit out of order, but I'll try to make sense of it. So for today, as we get into our work group sessions in the afternoon, we're going to break up into 4 groups, and probably we'll carry these 4 groups through the next 4 meetings. A hospital group, an ambulatory group, ambulatory surgery centers, long-term care group, those types of facilities, and others. If you don't fit into those groups, then this is the group that you want to look at, the other group. Not that that's a bad thing, that's a good thing, because you're all necessary. And I think the key point to this is the success of these work groups around preparing us for the CMS rules really relies on you. We can provide some tools, we can provide some facilitated discussions, we can provide some assistance, but really what we're hoping is that we can garner the expertise that's in the room to help all of us get to the next level of achieving compliance with the CMS guidelines. And if you're not in one of those groups, or you're not required to comply with CMS, if you're military or government entity that is just part of our coalition, you're also a valuable resource. So please participate in one of the work groups to provide some feedback and some input to those of us that still need it. The strategy is that with these work groups, we will have the work groups assign a chair. The work groups are really being put together to share resource ideas and successes, to share plans, and please share contact information so that you can know what your partners are doing, what your fellow facilities are doing to help you, to help them meet CMS guideline requirements. What we as a healthcare coalition can do is we're going to try to provide a facilitator for the work groups, not necessarily a facilitator, but somebody to help the work groups. Hopefully the chairs can take that role on a facilitation, but we will have somebody there to take minutes for your group, identify action items that the group has identified, needs that the group needs to move forward, share and explain available community resources. There's a lot of resources out there in our community that have already been developed or that are being developed that can help you better understand how to move forward on the CMS requirements, because a lot of it is built around collaboration. We want to be able to help guide you to what those resources are. We will help with facilitating the work groups for convening additional group meetings. We can also utilize GoTo, I think. I'm throwing that one out there. But we can provide GoTo for your work group to get together, to have these conversations and move forward if you so choose. We can really work to support the group. We can work to move you forward. But really it is the facilities, as you know, the facility's responsibility to achieve CMS compliance, but we're going to do our best and our darndest to help your work groups get you there. So if you look at the CMS rule, there's really 4 provisions for all the provider types that are in there, and that's really where we're going to try to focus our efforts in sharing resources. One of those provisions is risk assessment and planning. And really, I think if you look at it, it's almost the ultimate starting point of the work that gets done. Part of that risk assessment and planning is around hazard vulnerability assessment. So really that's what today is going to focus on, hazard vulnerability assessments. We're going to hear from 2 people today who have some expertise, some knowledge, some insight into this. Daryl Ruby has years of work with emergency management, with hospitals, with healthcare, with us as a coalition. And he's going to spend some time talking to us about what resources are available in the community and how that supports the work that you're doing. Dean Davis is going to provide and share with you the model that Deaconess Medical Center has used around conducting their HVA. So we'll hear from that. And that's the intent, is to share with you ideas so that you can take them back and help achieve your goals. So that's our focus for today. And then in our March meeting, we're going to conduct the same type of work. We're going to pull the work groups together, and we're going to spend some time talking about the emergency management plan. Then we're going to move on into May, where we start talking about policies and procedures. Along with having the plans, they're looking for policies and procedures that support the plan. And hopefully by then we can start bringing tools together that you guys have developed, policies, procedures, plans that can be shared across facilities that will help all of us achieve that next level that we need to get to. And then another component, a provision of that applies to all the provider types, is around communications planning. And we've got that slated for July to come back to the work groups and really focus on how we all can achieve the communication plan concept and ideas that we need to achieve CMS compliance. And then training and exercising is another component, which really is something that facilities are going to have to work on, but we as a coalition and we as a community are going to look at how we can really work together so that we're not all participating in multiple exercises, but how can we share exercises to achieve that goal a little more efficiently. And I think that's just kind of a quick rundown. Oh, the GoToMeeting? Okay, so for those of you that are on GoTo, I'm sorry to say that we can participate in the conversation through the presentation, but when we get to the workgroup format, we do not have the capabilities here in Spokane to broadcast that to the group members. So at that point, we would probably disconnect the GoToMeeting, and you can have the rest of the day to yourself. We will try to collect the information that's from the different work groups and share that out. And I believe that we would probably also have that available on our website, srhd.org/HCC. And now I would minimize this, but I really don't know that I know how. So maybe Elena can help me out with that while I move on to the next step. Any questions on that, kind of where we think we're going to try to go over the next few months? We've got a lot of feedback around CMS and how do we achieve these, and we're trying to develop a structure where we can bring you all together, help you share ideas, facilitate your work to help you get where you need to go, to hopefully ease your burden. And I think it's pretty safe to say that there's a lot of things that the coalition is working on already that will help you meet those CMS guidelines. It's just how do we make those connections, how do we make those relationships so that the work that we're doing as a coalition supports your emergency response plans in your facility. So with that, I think we'll go ahead and get started. We're going to do kind of a side step first, is kind of a flow of the process. We're going to have Travis Nichols come up, and he's going to share with us the HPP capabilities, which is a response document developed by ASPR, which really is going to lay the framework of how we as coalitions are formed, functioned, and what type of performance measures we might be faced with.